The Trump administration just dropped a bombshell that's going to flip obesity treatment in America overnight.
President Trump is announcing major deals to lower the cost of GLP-1 medications for many Americans.
That's 200%, 300%, 500%.
The president's promising patients will pay the lowest cost in the world.
Two world's largest pharmaceutical manufacturers have agreed to offer their most popular GLP-1 at drastic discounts.
Right now, GLP-1 drugs cost roughly $5,000 out of pocket for those without insurance.
They're slashing the price of GLP-1 drugs like Ozempic, Wegovy, and Zepbound, and adding insurance coverage. But before you get excited, let's talk about who actually wins here and who still gets left out. I treat patients with obesity every day. And here's the truth. 40% of Americans live with obesity, another third deal with overweight, and most of them don't have insurance coverage for the medications that actually work. These aren't vanity drugs. They treat diabetes, heart disease, liver disease, kidney disease. These are the real killers in America.
Obesity is the #1 driver of chronic disease. 50% of our adult population are obese or overweight.
For decades, obesity was treated like a personal failure, not a medical condition. Now, this administration is saying we're going to pay for it, just like we do for cancer or heart disease, and that's historic. I'll break down exactly what this means, the new prices, how coverage will actually work, and what to watch for when you hear politicians talking about cheap obesity meds. But there's a lot they're not telling you now. So here's what was announced. A new federal purchasing program called TrumpRx.gov. It's expected to go live by the end of the year. Through it, Americans can buy obesity medications at prices we've literally never seen before. Zepbound, $346 a month. Wegovy and Ozempic, $350 a month. And here's the wild part. Prices are expected to drop over the next 24 months to around $245 a month. That's still a lot, but for patients paying $500 a month right now, that's a massive shift. The new GLP-1 pills are expected to come out in 2026 and start around $149 a month for early doses. And even better, new, more potent drugs are already fast-tracked for 2026 and 2027. Starting in 2026, Medicare will launch a pilot program to cover those drugs for just a $50 copay. That's right, $50. That's lower than many people pay for insulin. To qualify, you'll need one of these, a BMI of 27 or higher, and you'll have to have prediabetes or heart disease. BMI of 30 plus with high blood pressure, kidney disease, or heart failure, or a BMI above 35. That's a big deal because right now, Medicare doesn't cover these meds until you've had a heart attack or stroke.
It drives about 50% of healthcare costs in this country. Diabetes, cardiac diseases, we are going to see a decline because of this historic agreement. We're going to see a decline in costs, but also more importantly, in the afflictions themselves.
Here's the catch. RFK said these prices would apply to everyone, but that's actually not true, at least not yet. Before private insurers can negotiate lower prices, they have to add coverage first, and that costs them and their employers a lot of money. So until that happens, it looks like nothing's changing if you have private insurance. So the translation, if your employer's plan doesn't cover it now, don't expect a discount yet, but this announcement will definitely pressure them to start. As an obesity specialist, this is the biggest shift in policy I've seen ever. We have medications that work, and we finally have a start to getting access to everyone who needs them. We've seen patients come off insulin, reverse prediabetes, improve heart function, because we treated the root cause, which is obesity.
I feel fantastic.
But here's the thing, these don't fix everything. There's poor habits, poor diets, physical inactivity that we'll need to address. And treatment is long-term with all of it. That's the real formula for success. So here's what no one mentioned in that press conference. These drugs are already FDA approved to treat more people than this policy allows. That means a lot of Americans who medically qualify might still be denied for coverage. So yes, this is progress, but it is a compromise. It's a step forward, but we still have more to go. If we get this right, pricing, coverage, prevention, this could be the moment we finally turn the tide on obesity. This isn't about political parties. It's about whether people can actually get the treatment they need. I think about one of my patients, a man in his late 60s, dealt with obesity his whole life, came to me years ago at more than 330 pounds, tried everything he could for years. He couldn't afford the right meds, and eventually we found he needed heart bypass surgery. If he'd had access earlier, his story could have been much different. For him and millions of others, that's what's at stake. This isn't about politics, it's about treating an illness that disables so many people.
Physically, my body is in a lot of pain. My feet, my hips, everything's burning. Like, I just want her to go get the car.
Do you like the outside? I've never been out here.
It's about preventing those diseases and helping people feel whole again. Medications are really needed for treatment, but they're not the whole answer. We need to fix our food system, make activity part of our daily life, and stop blaming people for a disease that has so many causes outside of their control. This announcement could change millions of lives if we get it right, because this time we have a chance to really see that obesity is treatable.